They walk the streets, eyes empty, bodies broken. Are they monsters from some horror film? No, they are real people. This is America's zombie apocalypse. It was not born from horror films or scary stories. It was born from drugs. In cities like Philadelphia, San Francisco, and Portland, entire neighborhoods are drowning in addiction. Heroin, meth, and the deadly fentanyl are turning thousands into living shadows of who they once were. They shuffle through the day with vacant stares and listless movements. Their skin may be pale, their eyes may be blank, but what's inside them is anything but empty. There is pain. Pain that throbs with every beat of their broken hearts. These are the zombies of America. Some call them addicts, others call them junkies. But these names only label them. They do not explain what these people go through. When they shoot up, they think they're buying happiness. But all they get is an empty high that disappears in seconds, leaving behind only the memory of pleasure and the promise of more pain when the cravings come back. When the cravings hit, they'll do anything to feed the monster inside. Sometimes stealing, sometimes killing, anything to get the next fix. This isn't a movie plot. It's happening right now in our streets, in cities across America. Every day, tens of thousands fall prey to this silent epidemic. They are victims, not criminals. They're trapped in an endless cycle of pain, withdrawal, and survival. Each day the drugs pull them deeper and deeper. It can feel like there's no way out. But there is always hope. America has seen its share of wars, fought and won many. But this war is the deadliest. It's a war without uniforms, without declared enemies. The weapons are hidden, the casualties untold. The enemy is invisible, yet its reach is everywhere. It's a war that's taken millions of lives, torn families apart, and left countless others wondering why. For over a decade, America has been battling a drug crisis, a silent killer that has struck at the heart of communities. And now, a new report reveals the grim toll it's taken. 1 million dead Americans. It's not just a statistic. It's a tragedy etched onto the faces of grieving families. Behind each number lies a story, a life cut short, dreams deferred, a family's broken chain. The numbers tell a story of a nation grappling with a nightmare it never saw coming. Overdoses from opioids and drugs have become a grim part of American life. It's a crisis that knows no boundaries, touching communities both rich and poor. The rise of fentanyl, a synthetic opioid, has only made things worse. Since its appearance, the death toll has skyrocketed. What began as a public health issue has turned into a full-blown catastrophe. They say grief comes in waves. For some families, the waves have crashed over and over again, stealing not one but multiple loved ones. It's a pain that's almost unbearable. To make matters worse, the stigma surrounding addiction often pushes families to the edge, forcing them to hide their pain and their loved ones away. So how did we get here? How did drugs turn a nation against itself? The story of America's opioid crisis is a tale of two epidemics. The first was sparked by the overprescription of opioid painkillers. Doctors were quick to prescribe these pills for any ache or injury, leading to a surge in addiction. As the crisis evolved, the drug supply chain shifted. Fentanyl, a cheaper and deadlier alternative, flooded the streets, causing a massive spike in overdoses. The problem has grown so big that it's been labeled a national emergency. And while the numbers paint a grim picture, they also tell a story of resilience. Communities across the country are standing up to fight back. Local organizations are working tirelessly to provide help and resources to those struggling with addiction. Support groups offer a lifeline to the lost, pulling them back from the brink. The fight is ongoing, and the challenges are immense, but hope remains. With understanding, compassion, and support, we can help those caught in this crisis.
Ow.
They say knowledge is power, but sometimes the truth can be buried. For decades, the dangers of opioids were ignored, the warning signs dismissed. But the numbers don't lie. We've lost hundreds of thousands of lives. And the worst part, most of these deaths could have been prevented. If we had listened to the science, if we had faced the problem head-on, if we had shown compassion instead of judgment, perhaps things could have been different. When someone succumbs to an overdose, it's not just a loss for the individual and their family. It's a loss for all of us. It's a loss of potential, a waste of a life, a wound that will never fully heal in the community. Overdoses steal more than just lives. They break families and leave communities shattered. Children grow up without parents. Partners are left without their other half. Entire communities are left grappling with the loss. Imagine a world where a simple prescription could lead to a lifetime of addiction or even death. That's the world we're living in. But even in this darkness, stories of hope emerge. People are rising to the challenge, turning the tide against the zombie apocalypse. Communities are banding together, offering treatment, shelter, and a second chance. Families are stepping up, offering support and understanding. Healthcare professionals are on the front lines, providing treatment and counseling. It's a long and arduous journey, but it's a journey worth taking. These are the unsung heroes of the zombie apocalypse, the ones who don't give up, who believe in second chances, who show compassion when others see only despair. As we look to the future, we must remember that every zombie has a story filled with pain, despair, and often trauma. Many of them started as ordinary people, your neighbors, friends, or even family members. But addiction doesn't discriminate. It can strike anyone. The path to recovery is a difficult one. Withdrawal symptoms can be brutal, both physically and psychologically. The cravings are intense, testing their resolve. But with support, they can overcome this. Treatment options are available, offering medications and therapies to ease the withdrawal process. As we move forward, we must address the root causes of addiction. Many turn to drugs to self-medicate, escaping from a reality they find too painful to bear. We need to ensure that everyone has access to quality mental health care. We must break the stigma surrounding mental illness and addiction, creating an environment where seeking help is seen as a sign of strength, not weakness. Imagine a world where no one has to walk the streets as a living corpse, where no one has to inject poison into their veins to escape the pain. We can create that world. It starts with understanding, progresses through compassion, and ends with action. Over the past decade, the United States has witnessed a surge in drug-related deaths. According to official data, more than 1 million lives have been lost due to overdoses involving opioids and other drugs. This crisis is particularly alarming due to the increasing number of young people falling victim to substance abuse. In recent years, there has been a worrying trend among the youth. The use of substances such as fentanyl, which is often mixed with other drugs, has led to a sharp rise in overdose deaths among young adults. Notably, the age group between 25 and 34 has been hit hardest with a staggering 200% increase in overdose deaths compared to 2019. Similarly, the 18 to 24 age bracket has seen a 70% rise in such deaths during the same period. These figures paint a grim picture of a generation lost to addiction. The widespread availability of lethal drugs, coupled with a lack of access to affordable mental health care, has contributed significantly to this crisis. Furthermore, the social and economic challenges faced by many young Americans have exacerbated the problem, pushing them towards substance abuse as a means of escape. However, amidst this despair, there is hope. Communities across the country are actively working to prevent drug abuse and reduce overdose deaths. Educational campaigns, support groups, and rehabilitation programs are making a difference. Additionally, initiatives to improve access to mental health services and create economic opportunities for young people are showing promise. Despite the progress, much work remains to be done. Addressing the root causes of drug abuse, reducing stigma, and providing comprehensive support systems are crucial to saving lives. By working together, we can create a future where young people are empowered to make healthier choices and break the cycle of addiction. They are not monsters from movies, but real people struggling with addiction. They are the living dead, walking among us, trapped in a nightmare from which they don't know how to wake up. But we can help them wake up. We can reach out, offer a helping hand, and show them that there is light at the end of the tunnel. Because every zombie is a human being first. Every zombie has a story. Every zombie deserves a chance to live. We've said before, and we'll say it again. This is not just a story, it's our story. It's a story of pain, yes, but also a story of hope. A story that reminds us that no matter how dark things get, there is always light. Thank you for watching. If you liked the video, give it a thumbs up and share it with your friends. Don't forget to subscribe to get notified about new videos. Stay connected. Until next time.